Welcome to you all again. So in this session, we'll be learning about foreign body indoors. Very interesting topic, very common topic in the ENT OPDs. One is foreign body. Why and how are we going to treat this foreign body indoors? Foreign body indoors can be actually a case of nasal myiasis. It can be a case of certain buttons. It's more common in the case of children. Of course, they keep on playing with something, some of the other thing, maybe coins, maybe small peanuts, maybe a chocolate, which they can just insert it inside their nose. Because of that insertion, there might be certain irritation, there might be a unilateral discharge, and the most common presentation, which is often asked in the examination, is unilateral, foul-smelling nasal discharge in a playful child. This is the presentation, usually. Okay? So foreign bodies can be divided into inanimate and animate. Animate means living. Living foreign bodies may be maggots, maybe leech, okay, or maybe certain other insects. Okay? Inanimate foreign bodies can be vegetable. It can be certain objects, maybe eraser, maybe duster, not duster, maybe eraser, maybe pencil tip, okay, maybe a small button that you use in the case of that remotes, small buttons, or it can be just a collar button. So they can just insert it inside your nose. Or certain peanuts, that ones are the vegetables. In the vegetables, certain peanuts, pea, maize, grain, okay, these can actually be inserted. Non-vegetable, paper, cotton wool, pencil, eraser, chalk, and sometimes mineral also, like chalk, metallic screw, okay, disc batteries, pebble. These are actually classified. So this classification is very important. Inanimate, animate. Animate means living object. Inanimate, there is vegetable, there is non-vegetable, and there are minerals. In minerals, actually you can write in non-vegetables also, okay? It becomes an easy classification. So, what can be the etiology? Of course, self-insertion. They were just inserted by themselves, right, into the anterior nares. Or it can be an accidental insertion, right, into the posterior nares by vomiting, coughing, penetrating wound, nasal surgery caused pad left behind, or palatal perforation. So, basically, this most common is self-insertion in the case of children. But it might also happen that foreign body might also be present inside the nose. The person might be unnoticed. For example, he's going on the endoscopic sinus surgery, the doctor leaves behind a gauze piece. That is very much uncommon, but this might happen. Or it can be into the posterior nares by vomiting or coughing. Like basically what happens is when you just vomit out, you might have noticed some secretions come from your nasal cavity. Sometimes food component can also come into the nasal cavity. When that food component, whereas some of the food component might get stuck into the posterior poena. It gets stuck in the posterior poena while vomiting most of the cases. Okay, the food particle stuck in the posterior poena, that leads to a bilateral nasal obstruction, foul-smelling bilateral nasal obstruction. Okay, so there can be nasal or it can be a palatal perforation. In the case of palatal perforation, of course, palatal perforation is a very bad condition. Wherever there's a palatal perforation, we don't offer surgeries even for endocrine hypertrophy or tonsillar surgeries, right? It's contraindication. Next is pathophysiology. So neglected foreign body will lead to stasis of secretion and infection, pressure effect, mucosal damage, ulceration, granulation, calcification of the incipient mucosa, rhinolith formation, leaking. This battery may cause necrosis and septic perforation within hours. So the slide is self-explanatory. Okay. The thing is, whenever there is this neglected foreign body, what happens is there might be granulation tissue all around. Okay, granulation tissue all around. That granulation tissue all around may actually lead to obstruction. And when you try to remove it with the hook, there might be massive bleeding. There might be epistaxis. Okay. So unilateral nasal obstruction, foul-smelling discharge, the mucosa may get damaged. Because of that damage, because the mucosa may not get released, right? Secretions, maybe there may be stasis of secretions. Okay, it's a difficult condition. And of course, battery is very dangerous. Battery in ear also is very dangerous. If in case there's a battery in ear, you never go for syringing in the external canal, right? And similarly, here also, if there's a battery, it's very much dangerous because that can lead to septal perforation. If there's a septal perforation, there will be septal perforation may be there, or there might be a septal abscess, okay, necrosis, which is difficult. So, of course, we talked about inanimate and animate foreign bodies, right? Nasal obstruction, purulent or prostrate nasal discharge, epistaxis, hyposmia, right? Now, serosyncosis, foul smelling discharge, there might be fornication, marked swelling of the nose, cheek, face, and there might be fever. Now, remember one thing that the animate foreign bodies like leech, maybe there might be certain maggots, okay? Then from there might be actually release of that eggs, and from there certain organisms may actually come out from the nose, right? So you can look into this diagnostic nasal endoscopic picture. Okay, different substance has been obstructed here in the nasal cavity. This is a metallic ring obstruction. Like leech, which was taken out from the nose. Metallic screw. This is metals. The non-animate bodies basically comes under metallic classification, but you can write non-vegetables. So diagnostic unilateral nasal obstruction with blood stain, foul smelling nasal discharge in children, foreign body until proven otherwise. Right? Foreign body may be seen on anti-rhinoscopy, or foreign body may be hidden behind granulations. It's felt on probing. As I already told you before in the slides that whenever there's a foreign body, there might be granulation formation. Because of the stages of the mucosa, there's excessive, sometimes there might be calcium deposition, stone deposition, which might actually lead to rhinolith. Okay, that means rhinolith. X-ray PNS lateral view show radio-opaque foreign body. Okay, nasal endoscopy, it shows a radiolucent foreign body. Okay. So, how are you going to treat this case C? This is a Tilly's nasal dressing forceps. You can actually remove from there. You can also sometimes remove from eustachian tube catheter. Actually, there's a position by which you keep the child, and then it's one step go. If in case it's very much obstructed and it's very difficult to take out, first you try with local anesthetics. If not local anesthetics, you have to go for general anesthetics. Okay? In the case of rhinolith formation, but usually foreign body it just comes out. In the case of child, very uncooperative child, of course you have to go for anesthesia. But in a normal child, ask the patient to ask the parents to hold the child, hold their legs, hold their hand. I think there is a picture. There's no picture. So this is actually the. So I just wanted to show you this eustachian tube catheter. So this catheter it goes like this behind in this way, right? This is a Fogarty catheter, but this whenever we talk about foreign body removal, this eustachian tube catheter also it's very much used. It's so similar to here. It goes like this behind the foreign body, and just you take it out in one go. Okay. So treatment: foreign body hook called foreign body hook or eustachian catheter pass beyond the foreign body and foreign body gently pulled forward. Okay, just pull it. Okay, pull it in one go. If you slowly pull down, it will not. Okay, the patient will start crying and it will be very much hasty. Just pull it in one go. Okay, just don't pull it in such a way that it will lead to like turbinate damage. Pull it in a way that comes out in one go. General anesthesia is needed for uncooperative patient impacted or deep foreign body. Okay, and excessive bleeding. Bleeding is so much. It's collected here, all crusting. Because of that also we are not able to visualize it also, and very uncooperative patient. Leech, how leech and all this removed? You can use actually turpentine oil. The turpentine oil and these turpentine oil is used. Use chloroform water, and if in case leftover components there, you can remove it by Tilly's nasal forceps. Leech removed after putting pinch of salt or hypertonic saline or few drops of oxalic acid on the body. Maggots are removed by after putting turpentine oil. Soaked ribbon gauze packed in the nasal cavity with Tilly's forceps. Okay, you use turpentine oil, and you can sometimes use chloroform water also. Just press it off and then it will come down. Okay, turpentine oil as well as perfume water. You'll use these for, and for leech. For leech, there's a picture here also, right? Yes, this one. See, there's a leech. How are you going to take out that leech? So leech, just put a pinch of salt. I remember whenever in Nepal there's a lot of trekking going on, right? So whenever there's trekking in the rainy season, sometimes leech, they get very much close to your leg, and our ancestors used to just put a salt in that leech. The same thing. Just put a pinch of salt or hypertonic saline or few drops of oxalic acid on their body. They'll just come out. Okay. If not, you can use a Tigris forceps. Same. Okay. Pinch of salt or oxalic acid. Hypertonic saline, of course, salt mixed water is a hypertonic saline, right? So you don't need to mug up this hypertonic saline and oxalic acid.